It doesn't have to happen. You don't have to have cognitive decline. And while they haven't developed a cure for dementia, there are ways that you can prevent it and you can protect yourself from it. The same way that you can protect yourself from other disease, there are certain things you can do.
Hi, welcome to the Dr. Keith Darrow podcast. Today, we're actually on site at the WTAG studios where I am interviewing a friend, a colleague, and a patient. And yes, he's allowed me to reveal that he is a patient. So please welcome with me today, Jim Polito, a radio personality, former Fox News TV host. Jim, thank you so much for being with us today.
Well, thank you, Dr. Keith. It's great to be here. It's an honor.
So, Jim, I got to say, we've been working together now for what, 5? No.
At least. More than that.
I want to say about 7 years at least.
At least.
And I remember when we first sat down, you said to me, I would love to be a sponsor of your show. I love everything you're doing, and I need help too. You know, I was exposed at the music and working in the factory, and I just looked at you and I said, Jim, I'm always here for you. But you didn't come in right away.
You know, and if I could say to people who are watching this right now, don't follow my example. I mean, follow my example once I got in touch with Dr. Keith and said, now I'm ready to do something. Follow that example. But don't follow the example leading up to that. And don't be that person like me in that room. Gee, Dr. Keith, you know, I really need to do something about this. But right now I'm all set. Let's just take care of this other business. Don't do that. This is the most important thing for you to do. And I really, there's not a day that I don't think, why didn't I start this so many years earlier?
But Jim, you're not alone. It takes the average person 7 years. So while I think you're way above average, when it comes to your hearing loss, you kind of hit that average mark of, we met, you already said I have a problem, and then it still took about 4 years for you to come in. So you hit that magic number of about 7. What was in your head? What was that struggle, or dare I say denial, that you were going through?
It was a form of denial because I was saying, oh no, maybe it's not as bad as I think. But my wife, Kathy, really helped me to do it. And she said, Jim, Dr. Keith is now your partner. He's now sponsoring the show. You're talking to people, telling them to do something about it. You need to do something about this. And I kept saying, I will. I know, I believe in Dr. Keith. I will. I think it was finally just not the denial, but listening over and over again and introducing you in when you make presentations to the public and saying, I can't go on not following this. And maybe there was some denial, or maybe the better word is avoidance. It was really like, do I really want to be told, oh yeah, you have hearing loss. Oh yeah. And it's bad, you know. But, you know, I had to remind myself that, well, I may have to hear that diagnosis, but who better to be with when I hear that diagnosis than the person who can do something about it? And I know that hearing loss can't be reversed, but I know it can be treated.
That's excellent insight. Can you dive a little bit deeper in those years before treatment? What was it like? What were your symptoms? What are the things you were dealing with?
I mean, the biggest symptom was, and Kathy knew, and she was somewhat of an enabler. Well, not an enabler, it was just, when we are out with another couple and we're in a restaurant and there's a lot of talking and loud, sounds, just a nice crowded restaurant, which is fun. We would strategically make sure I was positioned at a place where I had the greatest lean-in room to be able to lean over the table, and that I was in the center of where the conversation would be. Because when there was a conversation and when there was background noise, I could hear, I couldn't understand what the person was saying. I got very good at reading lips. I got very good at cupping my ear. I got very good at leaning in and paying attention like that. And it's amazing how the human body can adapt and the brain can adapt, but it can only bring you so far. Now I sit at a restaurant like that, it doesn't matter where I am. I hear things that people who don't have hearing issues are hearing or can understand. And that's the important thing. It wasn't hearing. It was understanding what they were saying. I could hear it. I just couldn't understand it.
That is probably the most common statement a patient will make, which is, doc, I can hear. I'm just having difficulty understanding. And it must be because the restaurant is really loud. It must be the background noise. It can't be me.
Right.
Now, understanding in crowded restaurants, we talked about that a lot, and you brought that up, and that was one of the things that we addressed. What about the tinnitus? Tell me about your experience with that, because I know you, like many patients, not only waited that 7 to 10 years, but had difficulty understanding, and the number 2 symptom, which sometimes this reverses for patients, sometimes it's number 1, is that ringing in the ears. So before treatment, what was that like? Was it bothersome? Did it get in the way? When was it worst?
Yeah, because it's number 2 for me. I know for some people, it's maddening, truly maddening. It was always there. And I think the first time we met, I told you, well, we used to call it a noise hangover. You go to a concert or you're doing sound for a band, and the next day it's very, very loud. Wakes you up in the morning. And you're like, oh, yeah, we went to that show last night. For me, it was ever present. And I will say that it wasn't loud enough that it would disturb me regularly. I almost hate to say I became somewhat accustomed to it and tried to work around it. I didn't realize how bad it was until I got my devices, started wearing them, and then when I would take them out, not the fact that I'd have trouble, hearing and understanding people again, but that sound would come back, that and for me it's a high pitch. I know for some people it's whooshing or whirring, high pitched. And I said, wow, there it is. It comes back when I take these out. I begin to notice it. And I can understand how for some people, if it's louder, if it's more present, just how, I don't think the word annoying really describes it. I think maddening.
So it's been, if memory's correct, it's been about 4 years that we've been treating
about 4 years.
That we've been treating your hearing loss and your tinnitus.
Yeah.
What is that like now? Because you talk about, and again, specifically tinnitus, you talk about taking them out, it's still there. Are you noticing long-term changes?
In the sound of them?
Yes.
When I take it out, yes. I've had these in now, I think it's more than 3 years. It's got to be more than 3 years.
I think so.
Now that you've been treating me. I do find that it's not as great. What I do notice more than the ringing when I take these out is the inability to understand people. I notice it immediately. And just as the tinnitus, when I first took these out in the early days, it would come back right away. The difference in how I hear and understand people, now that it's been a long time, the tinnitus isn't as great when I take these out. But the ability to understand people, if I took them out right now, well, we're close quarters, but if I did take them out right now, I bet I would slip back to looking at your lips, to understand the difference between dog and log. Just to have to think the context of a sentence to know the difference between those two words.
What does that make you think of? How does that make you feel that you have now realized what most people take for granted is their ability to hear?
Yeah.
What your brain is telling you when you take these out is please put them back in.
It really
I
is.
can't hear. This is not good. We shouldn't be living this way, Jim. I need more. What is that acceptance over time? What has that been like for you?
You know, it's funny you talk about it like that, because now it's so second nature for me that I don't have to worry about those things. I mean, having this conversation with you is bringing me back to there, which I don't really think about much. I try to, from the perspective when I'm doing a commercial for you and try to, relay what my experience has been to people. But it's hard for me to go back to that. And really, I don't want to go back to it. There's no way I want to go back to it. It's like, this is permanent. This is, and if I age more and if the hearing loss, continues, or certain frequencies I have trouble hearing them, the adjustments will be made here. But this is now part of my life, like putting on a ring and a watch and everything else that you don't even think about. Putting on your tie, getting ready for the day. You don't think about it. Shaving in the morning. Don't think about it. How could you go back to?
And is there any, now that you say it, has it changed your routine? Is it complicated? Is it difficult to manage the technology, clean it?
No.
Some people have that fear of, I don't want another piece of technology that I constantly have to take care of.
Don't be fooled by this background of all this high-tech equipment. I can work about 3 things here, okay? So I'm not the most technically savvy person. And as much as I know what good audio is, I don't understand the technology that goes into making it. These are easy. Out of the charger, in the ears. Once a week, change the little pieces that fit into the ear. That's it. Nothing. I don't think about it at all. As a matter of fact, I don't think about it so much that I forget to take them off and get into the shower. I mean, it's not like you're wearing a brace. It's not like you're wearing anything that you're going to know of. I forget they're there. Hence, I'm afraid sometimes at the beach, I won't bring them down because I'm afraid I'll walk into the water with them. No, seriously, with them on. And as much as they can take a little bit of water, my luck, I would destroy them,
Well, they'd fall out in the ocean.
Or they'd fall out in the ocean.
But you're covered for that too.
Right,
The
right.
warranty
I
has
would
you
be right.
covered.
And someone in Great Britain would get a lovely pair of devices.
So now, look, I've often, and I'm sure I'm not the only one, I've often called you, texted you, and when I get on with you, the first thing I say is, Big Jim, how's it going?
Yeah.
Right? Like, to me, you're Big Jim. I had an uncle, Big Jim, and it's everything from big personality, big voice, and although it's not obvious right now on camera, big guy.
Yeah.
Right?
Yeah,
You've always been just a big guy. You're a presence in the room. But that, too, has started to change. You're still a big presence. You still have a big personality and a big voice, especially when on air. But you have certainly started to change your overall lifestyle in the last few years. And I think the way I've perceived it is we did our part by helping to make sure that you can socialize, you can be part of the world around you, hear everything.
Yeah.
And that was a little bit of a kickstart towards active aging for you. And what has that process been like?
Well, I mean, I lost a lot of weight, 85 pounds to be exact. And I'm back at a weight that I haven't been at, my goodness, 15, 16 years. I mean, people joke about TV. Oh, the TV adds 20 pounds. And I always say, but the radio adds 80. Because when I worked in TV, you keep your weight down. You're seeing yourself every day on camera and everything. Oh, boy, I got to lose some weight. And you have to in that business. I got to radio and just kind of relax. And getting up early in the morning is hard on the system. But I finally, like with the issue with my hearing, I finally got to the point and said, I've got to do something about this. And I think you come to that point, and you had said earlier, denial. Like, I wasn't in denial about it, but I was just complacent about it. And you start to get serious and say, no, this is important. I mean, my other doctor, not Dr. Keith, would say things like, Jim, you've got good genes from your parents. They lived long lives. You're pushing it now. You're going to get older, And when you get older, the weight is going to impact, you know. And he would say, I have people who are your age and who are not your weight who would love to have your genes because they're dealing with cholesterol, blood pressure, these things, sugar issues. You're going to begin to deal with that, but it's going to be at a later age. Why push it? And so really it was kind of the same recognition. I wasn't in denial about the hearing. I wasn't in denial. I saw myself in the mirror every morning and, you know, I was self-deprecating about it. I knew what I looked like. I'm honest. But I finally decided to do something about it. You know, no, not denial, but finally, let's get this fixed.
And you say fixed. What do you mean? What was the straw that broke the camel's back that said, okay, was there an incident?
Yeah, there was. It was COVID. You know, everybody in my family got COVID in December of 2020. The boys were home from college. Kathy got it. I got it. People we knew got it. But for the most part, they were, well, I have a scratchy throat. I have a head cold. I ended up with a fever that was almost deadly and spent 10 days in the hospital, very close to getting onto a respirator. I didn't have any other issues that would make COVID any worse for me. Not diabetic, no heart disease, nothing. But it was overweight. And I think that's why it hit me. And when I was laying in that hospital bed, you know, making bargains and promising to do certain things, one of them was, I'm going to lose this weight. I got to get this weight off. I'll bet that if I were like this, that I'd have COVID just like everybody else in the family and I'd be fine. That was the straw. I mean, that was really the straw. And it was almost like, I think some people say they have that moment, they get a heart attack or they have a chest pain and the doctor says, oh, it's just a little something, we can fix it. And, you know, they quit smoking and they lose weight and they do healthy things. For me, that was my moment. And since I was making a lot of other promises upstairs, you know, I kept them all, and this one I really kept and got the weight off.
So it sounds like you're truly committed to an overall healthy lifestyle.
Yeah.
Your healthy hearing means a healthy brain. Your healthy eating, your healthy lifestyle means a longer life. And what is your ultimate goal in being healthier?
You know what it is? I had a taste of it. When I had COVID, I got the brain fog people talk about. And that scared me on two fronts. One, it reminded me of the fact that thank goodness I got my hearing treated. But it also reminded me, I wish I had done it 10 years earlier so that maybe some of the damage I was doing wouldn't be prevalent. To experience the brain fog when I'm sitting here and a name or a concept or something that just would roll off my tongue because I have to talk for 4 hours a day, to be here and to have it not, to go to the well and it's not there, that was frightening. And I think about, imagine if that was permanent, and imagine if it kept, if the decay continued, if the decline continued. Luckily, the brain fog went away after a few months. I'm fine. Luckily, I lost all the weight. I survived COVID. I'm fine. The message really is, don't wait like I did until you have a moment of clarity. Just do it. Take it from somebody. Learn from my mistake. Take it from me. Do something about the hearing loss and get yourself healthy.
And what would you say your one biggest lesson about cognitive decline, about dementia and the role of hearing and overall health? What's your take-home message that you've sort of ingrained in your head that you go and tell your friends and family now?
It doesn't have to happen. You don't have to have cognitive decline. And while they haven't developed a cure for dementia, there are ways that you can prevent it and you can protect yourself from it. The same way that you can protect yourself from other disease, there are certain things you can do. Don't sit there in a restaurant across from somebody and overtax your brain trying to figure out what they're saying. I did it for far too long. Take it from me. I wish I had adopted this treatment, this therapy a long time ago. I didn't. So don't be like me. Don't do it. When you know that you have hearing loss, and when you have a loved one who you trust is telling you you have hearing loss, and if you're saying, yeah, Jim, I try to understand what people are saying, you're there. Go to the Hearing and Brain Centers of New England. Don't wait, just go.
Are there any other resources that you would encourage patients to look into to learn more about your process?
Yeah.
What you've been through?
I would read your book. Which for me was somewhat of a scary novel, because I kept reading, that's me, that's me, that's me. And then you pull in the research. And the one thing that you can say about people who experience cognitive decline, look at the numbers, they're hearing loss. Get the book and read it. It's an easy read. And again, I say it's a horror story for me, but it is. Educate yourself, protect yourself. The same way that you would about certain things, about certain foods you shouldn't eat, or certain things in your diet, or things that can help your overall health, read the book. It's kind of like a roadmap.